years-old male, admitted to our hospital with a chief complaint of severe epigastric pain, and the pain is radiated to his back. After ingestion, the pain is worsened, and he took ibuprofen 3 times a day to relieve his pain. But the pain is increased day by day, and he had interstitials in the early morning, which he had never experienced before, as well as epigastric burning pain. His family stated that he vomited 3 times a day with a vomit consisting of food particles, and that he was very weak and tired. They immediately called an ambulance and took him to Hatta Hospital, where a physician performed an endoscopy and ruled out a gastric ulcer. After that, the doctor prescribed some medication that is used to treat the gastric ulcer. So I am and my colleague were going to talk about it more in details in terms of their food and drug interactions and the side effect, and also the nursing consideration of the drug that will given to the patient. Peptic ulcer is a condition which in lymphocyte or ulcer develop the mucous membrane of the gastrointestinal tract. It's characterized by damage to the mucosa due to pepsin and gastric acid secretion. There are 3 different types of the peptic ulcer. The first type, which is esophageal ulcer that develop inside the esophagus, and the second type, which is the gastric ulcers that occur inside the stomach, and the third type, which is the duodenal ulcer that occur in upper and the first part of the small intestine, known as duodenum.
In UAE, they found that the cases of peptic ulcer diseases increased during Ramadan and the month after Ramadan. Also, after many studies, they found that peptic ulcer diseases incidence and prevalence where and when the Helicobacter pylori are present.
So, we have 2 main causes of peptic ulcer, which is the basic 2 main, which is the H. pylori infection and non-steroidal anti-inflammatory drugs. These 2 things are 2 basic of peptic ulcer. Why H. pylori infection can causing peptic ulcer? Because the H. pylori infection can be damage of the stomach barrier, and then from this damage it can causing open, which is ulcer. And for non-steroidal anti-inflammatory drugs, people who is using a lot of these drugs, it can also make irritation of the stomach barrier and it can causing ulcer. So, who is the people at risk having peptic ulcer? People who is smoking, people who is drinking too much alcohol, people with upper abdominal radiotherapy, people who is having liver cirrhosis, and Crohn's diseases.
Clinical manifestations associated with peptic ulcer diseases include abdominal burning pain, heartburn, nausea, fatty food intolerance, bloody or dark stools, abdominal fullness, changes of the appetite, unintended weight loss, and bloody vomit.
Medical management. The goal of medical management is to kill H. pylori infection and reduce the acidity in the stomach. Method to use including lifestyle change, avoid smoking, and avoid alcohol. And also the nurse will educate the patient to eating healthy food and adherence with medications. Even if there is no symptoms, the patient have to adherence with medication and continue with medication. And also the nurse will tell the patient come back to the hospital if there is any severe complication that could happen to the patient. And also he have eating a healthy food, like for example eating a lot of vegetables, eating a lot of fruits, and avoid the spicy food and also avoid the food with a lot of oil.
Now, with the generic and the trade name of the medications, beginning with the proton pump inhibitors, and it is include esomeprazole. Esomeprazole is marketed as a trade name of Nexium. Other classifications like histamine 2 receptors, and it is include famotidine. Famotidine as a trade name of Pepcid. Antacid like aluminium hydroxide, and it is marketed as a trade name of Nefrox. Antibodies including amoxicillin. Amoxicillin is marketed as a trade name of Amonixil. Proton pump inhibitor is the drug of choice because of its higher success rate. Patients often judge the effectiveness of a treatment based on the effects they perceive. All patients felt that proton pump inhibitors controlled their symptoms better than other medications they had tried. Most patients reported that their symptoms were better controlled by proton pump inhibitors.
There are also 3 pharmacological drugs used to treat peptic ulcer, and they are omeprazole, pantoprazole, lansoprazole. Omeprazole, that's to treat stomach ulcer. Its work by reducing the amount of acid. Pantoprazole, this is a type of a proton pump inhibitor. And lansoprazole, that's too effective for peptic ulcer disease. It is also effective against H. pylori at clinical doses.
The doctor has been ordered a protein pump inhibitor for our patient, PPI. How does this medication work? The mechanism of action is working by decreasing the gastric acid secretion by slowing the ATPase pump surface on the precious cell that's located in the stomach. The goal is to do a total inhibition of the gastric acid secretion, to inhibit so there is no more gastric acid will be produced by the stomach cell, which is the perishable cells. The doctor has been ordered specifically omeprazole. Omeprazole is a type of the PPIs, which is a protein pump inhibitor. We should be noting that it's not safe for any pregnant women. Should not be taken for any pregnant woman because it's from category C, so it's have a highly risk. What are the side effects of omeprazole? Omeprazole having side effects could be leading to diarrhea, nausea, constipation, abdominal pain, vomiting, headache, dizziness. Also, it's have a drug interaction, so we should be careful while we're taking it. We should not be taking it with warfarin and diazepam because it's due inhibition of the warfarin function and the diazepam metabolism. So we should be careful to not take it with warfarin and diazepam. And it's less commonly do interaction with the other PPIs like pantoprazole or lansoprazole. So the main thing, it should not be taken with warfarin and diazepam. Note that. The food interactions, it should be taken 30 minutes before meals because it's leading to nausea, as I said. Also, it should be not taken with any dietary product like milk, sugar, cream. It should not be taken with that. Or any vitamins that have a B12. So anything that has B12 vitamin or dietary. Also, any acidic liquid should be avoided. So the thing that avoided is the dietary product, the B12 vitamins, and any acidic liquid.
The nursing concentration for patients with peptic ulcer diseases are: for the protein pump inhibitors, it should be taken for 4 to 8 weeks. And to prevent problems caused by ulcers such as bleeding. Patients who use PPI should avoid alcohol and food that increase irritation GI. An example for protein pump inhibitors is omeprazole. The second type of medication is H2 receptor blockers. It should be taken for 6 to 8 weeks. Ranitidine is a type of H2 receptors. If the dose is more than 400 mg, the nurse should monitor liver dysfunction. Finally, for antibiotics, if the patient is on amoxicillin, the nurse should know if the patient has any allergies and see if the patient is infected by checking the skin color.